How do doctors prevent GVHD and leukemia? Graft versus host disease is a serious complication that can happen after a stem cell transplant for leukemia. It occurs when the donor's immune cells attack the recipient's tissues. Preventing GVHD is essential to improve patient outcomes while still allowing the transplant to fight leukemia effectively. Doctors mainly use a combination of medications, graft modifications, and careful donor matching to prevent GVHD. One of the most common strategies involves giving immunosuppressive drugs. These drugs include calcineurin inhibitors like cyclosporine or tacrolimus, which block T-cell activation, and methotrexate, which inhibits T-cell proliferation. This combination has been used since the 1980s and significantly reduces the risk of acute GVHD. In recent years, adding a drug called cyclophosphamide after the transplant has shown promising results. This 3-drug regimen helps lower GVHD rates and improve survival without increasing relapse. Sometimes, doctors also add antithymocyte globulin, which depletes T cells in the graft, further reducing GVHD risk without compromising the immune system's ability to fight infections or leukemia. Another important approach is graft engineering. This involves removing or depleting naive T cells from the donor graft. Naive T cells are more likely to cause GVHD, so their removal can lower chronic GVHD while preserving memory T cells that help protect against infections and maintain the graft versus leukemia effect. Researchers are also exploring cellular therapies like donor lymphocyte infusions, cytotoxic T cells, natural killer cells, and CAR T cells to enhance leukemia control without increasing GVHD risk. Advances in technology have led to the development of T-cell engineering methods, such as ORCA-T, which selectively modify T cells to reduce GVHD. Early studies show these techniques can significantly lower GVHD rates and improve the chances of leukemia patients remaining disease-free after transplant. Donor selection is also critical. Matching the human leukocyte antigen types between donor and recipient reduces immune mismatches that can trigger GVHD. Additionally, the conditioning regimens, chemotherapy or radiation given before transplant, are carefully designed to lessen immune activation and prevent GVHD from developing. In summary, doctors prevent GVHD through a mix of immunosuppressive medications, graft modifications, advanced cellular therapies, and meticulous donor matching. These strategies aim to minimize GVHD while preserving the beneficial graft versus leukemia effect that helps eliminate leukemia cells. Ongoing research and clinical trials continue to improve these methods, offering hope for safer, more effective treatments for leukemia patients undergoing stem cell transplants. Always consult healthcare professionals for personalized advice and treatment options.